So now on to the good stuff. The topic again, maintaining and building short-term career technical education programs. I spoke with many of you earlier in the year as the changes began to happen with Boston Reed, and it was going through the field some of those transitions and what it would mean. And in my calls to many of you and my emails, there was clearly a need to know what was happening with programs around the state and what ideas were coming aboard or coming from other programs in terms of how they were going to make transitions. And so in one of those conversations, I spoke with a colleague of mine, Dave Williams, and he is a highly experienced administrator, especially in the area of career technical education. And we talked a little bit about this idea and decided it would be a really great thing for him to share what he's doing in a webinar format for administrators. And so that is how we got to where we are today. Dave Williams from Beaumont Adult School, the principal there, will be presenting to you on this topic. And we believe that by the end of this, you'll be able to identify at least 2 resources of data so that you know how to identify CTE needs in your community, that you will also be able to identify at least 2 sources of how you find highly qualified teachers to teach your CTE classes. It's not as easy to find CTE teachers because often the pay differences prevent the interest, or they make it so that there's not as high a level of interest to teach in our schools. And so Dave has some ideas and tips that will help you. And then lastly, you will finish this with the ability to really start to identify what the budget needs and the fiscal needs would be to develop, continue, maintain, or build your CTE programs, and as well as identify some of the possible sources that can help you fund the CTE program to maintain it or continue what you have. There will also be an opportunity at the end of this presentation for some questions, as well as questions throughout, where we'll be asking you to type into the chat pod. So with that, I'm going to turn it over to Dave, and Dave has been patiently awaiting to present to you his topic on maintaining and building short-term career technical education programs. Dave, take it away.
Thank you, Sharice, and good afternoon and welcome to everyone. Glad to see everybody here. We'll be going through looking at the basics for creating, developing, or possibly maintaining something that you've had in the past of short-term career technical education. This presentation will provide administrators with an introduction to general planning, implementation process for development of or conversion to locally controlled short-term CTE programs. Areas to be covered in the presentation include determining specific need for CTE programs, including requirements for specific state industry level certifications, finding highly qualified instructors, and budgeting and funding CTE programs. And Sharice went over what the expectations and outcomes are for the participants here today. And I know, just like I presume many of you may have come from agencies or may be part of agencies that were operating short-term career technical education programs through a third-party provider, specifically Boston Reed, over the past several years. Our school was also running short-term healthcare career technical education. That was basically in supplement to the technical education that we have for other healthcare areas, specifically nursing. And we've run a number of different short-term career technical education, not always in healthcare. And we find ourselves, like perhaps some of you, that with the loss of Boston Reed as the third-party provider, and given our current funding climate, we really aren't sure what we want to do, and so we've also been investigating how can we replace those and still meet the community. Right now, since before we get into the regular part of the presentation, I'd like to open a chat pod and ask you, what are your expectations from this webinar, and if there are any specific areas related to programs that you would like to know about or have more information about, so that we can try and meet those expectations, provide that information if at all possible during the presentation rather than waiting in questions. So if there's any particular area or something that you really would like to know about creation of short-term development, replacement of the ones that you had if you were operating them through Boston Reed in the past, please you go ahead and type them in the chat pod there. Typing, so we should have something coming up. Expensive in comparison to basic adult education programs. How do you fund them and deal with concerns about the equity of cost to stakeholders? Excellent point. We will be addressing that, and in general, Burr, you're correct, and I'll point out that especially the startup cost on CTE programs generally somewhat prohibitive. That we need to develop CTE programs around specific careers that aren't included but are universal. Point. And we'll talk a little bit about that in terms of how we determine the need. But again, this is just the basic components for all CTE programs, so we may not get that far into some of the specifics. Good. I think we can touch on that. The best way to find CNA teachers, always a problem, and we'll talk something about that. We also have a CNA program as well as an LVN program, so I faced Boston Reed course is very popular on campus. Good. So would we. We have not done CTE or seriously interested in offering CTE. This is exactly the seminar for you, Carmen and Susie, because that's what we're going to talk about is how do we start. Placement and outcomes, very good. Relevance, all part of determining the overall components of a CTE program. Yes, we're going to try and cover some of those, although it'll be on a general basis rather than a specific basis. Because there are so many possible CTE programs, but we are going to talk about some of them, and particularly in areas that require certification licensing. Some of you indicated that you were looking for replacements for third-party providers, as we are in terms of the Boston Reed programs. Again, I know this is jumping right into it, but before we get too far, I would like to open up another chat pod, and this is if you had programs that were being operated under third-party providers and you've taken some steps in terms of trying to find replacement or considered other options, what are your plans for trying to replace or to implement the programs that may have been taken away by the loss of the third-party provider? That's a very key issue. I think somebody mentioned that CTE expensive in terms of capital costs to startup providers helps alleviate some of that. Provider about to jump in and fill the gap. Good. I have not seen that one. Are going to provide some information, also open talks with them. In some instances that's true, and that's one of the cautions that you'll have to look at in terms of so there are some of you that have looked into these, and one of them that was mentioned is one that we will be talking about. Let's look at a little bit about third-party providers before we get into the overall fundamental components of CTE programs. These are a few of the third-party providers, and they fall into different categories of ones that we have looked at from Beaumont and had some conversation with. Condensed Curriculum International, or CCI College, was very similar in terms of their course offerings to Boston Reed. Actually, in a few areas more diverse, and a few programs they were offering under their college third-party provider, Boston Reed had not. We were actually in consideration or working for an agreement with college back in the early part of January, when I received a call from them that asked us to not proceed with working out the agreement. Had found or had information that there was some sort of a liability or legal issue related to some program that Boston Reed had been running somewhere in California, and before they proceeded problem that Boston Reed had to ensure that it would not impact. Have not heard back from them since then. All of the information here on third-party providers is going to be available on the resource page on them. A couple of you mentioned MK Education. I also just received information I looked at, which has not been totally in depth yet. It looked more that they were of an education society and assisting schools with development of healthcare programs, but not necessarily providers such as like Boston Reed. Another one that I recently ran into, and actually are in the process of trying to get a contractual program. This may not work for everyone, but depending upon ed.com offers certified medical interpreter training, and actually have a number of programs on some adult schools in California that are currently operating on what their contractual stated that we are in the process of going through with are a turnkey third-party provider. When I say turnkey, I mean essentially everything else. They Boston Reed provided. All right, let's move into an overview in terms of CTE programs. Again, this is going to be kind of a basic overview because there are such a variety of CTE programs that could be operated through. But we're going to look at the basics in terms of the components of putting together just about any CTE program. Now, puzzle, a specific CTE somewhat different, but I'll try to cover the basics in all of them so that it could be applied to any specific area. Before we get going, a few definitions just to make sure we're all on the same page. When we're talking about short-term CTE programs, there really is no current definition according to CDE what entails a short-term education. I'm going to be talking about programs that are less than 6 months of time and less than 600 hours of instruction. Programs over that still fall into the general category of short-term CTE programs, but there are a variety of things that can be done with those programs. Discuss those today, but anything that's under 600 hours or much falls within the basic overview. Student certifications, that again was mentioned in the that is the certifications or outcomes for the students upon completion of a program, and we'll talk about those and how you determine those, what they may or may not entail. Tuition, just for we're all clear, tuition is the cost of instruction per student enrolled, as opposed to books, materials, and fees, cost of the books and specific materials, and should include fees for any certifications or examinations that are required by the student for certification. But a very first thing, determining need. Actually goes back a long ways when we were being funded for. This is a statement from Ed Code 52519 that was enforced long before I even became involved. It's always been a requirement to determine what is the need for a vocation. Now, but we still need to determine the need for a vocational program or CTE. One, we don't want to invest in the time and cost for a program without no viable and it meets the needs of our. Number two, all of us are probably involved in one way or another with our regional consortiums, funding through the regional consortiums and short-term CTE programs that lead to employment in high areas, jobs, are something that are authorized under AB 86 for some of the ways that we can look for, some of the areas where we can look for information on determining need. One, general labor market information. The link for that for the state of California slide. What I've found is that's valuable for some aspects, especially in specific career fields, because they have information related to fields or occupations. But usually it's by region, generally by county. It can project job openings for the future in a specific. What are the plausibility of a future employability and the need for that? But it may not be 100% relevant to your graphics of your county or region where you're trying to determine what the need is. Another way that we can look for determining the need or data, your regional consortiums over the next year are going to be involved in determining the need. But they're being tasked under AB 86 to determine the construction throughout their regions in all areas, so that you may be able to tap into or be part of that data gathering for the regional consortium. Look for specific needs in your area. It's also possible to use local surveys. Sometimes those can be done by regional economic development departments or workforce investment, local chamber of commerce, professional business associations under specific trades have information that are pertinent to the needs of past and employees within. A lot of the school districts right now are looking at expanding their CT offerings. I know Beaumont District just completed a California Career Pathways, and we are working very closely with our school district. In fact, part of their grant application incorporated some of the offerings that we have at the adult school, pathways for students from the high school. Also had to try to determine what was the need for the career technical education offering in the district, so you could tap into that information. You could conduct your own local survey if there's a very specific path or career occupation. Look at businesses or those types of about creating a local survey to see what they are in terms of employees. And one of the things you might want to consider in or any of the data that you is, are there other programs that provide for very similar or the same they're being offered somewhere near your area? College in your region offering similar programs for proprietary adult education, offering these types of programs. One, you can look at what, if they're offering them, what their enrollment is. Also look at what they're charging for the program, which will always good to know if you are type programs in your general area. Doesn't necessarily competing with them. As an example, offering the phlebotomy technician program, always was offering the same thing, but their camp our area for students or desire or cannot travel that 30 miles. That's all part of determining the need. Before we go on to the next one, I'd like to open up another chat pod, and even if you haven't specifically looked at determining need for a career technical education program, I'm sure most of you have been involved with determining some need for adult education in your specific. So if you would, what sources have you used? Need for other adult education programs in your WIB, that's excellent. If you have a good relationship and good communication with WIB, that can be extremely important. Some of us have not had the opportunity to stop. Yeah, generally they are tied to the WIBs. Back with employers, stakeholders, and colleagues. Self-conducted survey. Questions that could be asked on there. If you're conducting a survey of potential employers, questions would be how many openings are you considering? What are your expectations? Are there specific certifications or job skills that you as field so that you know what certification? Those are some of the more common questions. Pay scales, average entry level, possible potential for advancement would be other ones. Judge as to what the well as the level of wage. Very true. Filling the gap, again, as I said, even if it's not direct competition, but if there are gaps in terms of advisory groups, representatives from W. Yes, and if you don't have a community advisory board, you may want to look at trying to create one. Even if it's not specifically for CTE, but it could incorporate stakeholders for CTE as well as other stakeholders in the community for contract, the WIB will be contracting out for that service. That's good. I know ours has been kind of the same way. Request from local businesses is always good. I've often found that associations with a lot of other potential contacts that can help you job skills. If you call that would be an excellent function and a great collaboration. Welding is generally a very high demand career. It's something going for a number of years. Defense contractor, and we had a great need for welding. We actually worked out a partnership with a local our facilities, and we were taking some of that's one area that can help defray the capital cost of that program, which can be quite prohibitive. Super, you guys have some great sources in terms of where to get that now student certifications. That was one of the does come from different areas. Frequently, it comes from by the state or the industry. Nurse assistant or CNA governed by the California Department of Health, but a Microsoft Office specialist, which is a computer, is governed by the computer industry specific. Differences where they can occur between state certification or license, something that is a but in order to make a program that is that health aid certification, added in 2 additional certifications that were healthcare industry, CNA and home, governed by the state in terms of the what's. But we went to a number of from their specifications for employees and skills, we created an also created a restorative nurse's aid actually was a higher level certification than just the C. So there are times that you may have to set the certification yourself based on some industry standards, and you'll have to gather the industry standards or clinical practice if it's in healthcare, CNA. Pharmacy technician is an example. Others in outside testing certifications. That's the next thing is you need to determine if there are certification exams that will be included in your program. there is an examination that is required for governed by an agency outside of. You don't have to do this, but I found that generally, especially with need to provide the student a means. Otherwise, they tend with it. So we have always tried to incorporate part of the program to ensure that the students that are completing the program have the opportunity to get those certifications through an exam. That when we talk about budgeting and how you do that. The curriculum can be difficult depending upon the career area. You look at your student certifications and outcomes, that will probably be the primary developing your curriculum. Your that specific level of certification. Look at the requirements. Instruction if they're specified, or just specific areas of instruction that are some curricula can be purchased, however it can be quite expensive. But as many of you mentioned, it can be prohibited. Look at other sources. Other schools that were looking at some of our curriculum. We may or may not. Curriculum would be an area where some sort of a published curriculum. You have to pay someone to develop a curriculum. Potential instructor in the program, it may not be. And we'll look at this again with instructors, but you may have points of contact. They would have the necessary expertise. Program here a number of years ago. Hired contractor from our area that was taught it for a number of years before he retired. Curriculum will usually be determined by the required hours of instruction, that's it, rather the duration of our required hours of instruction under. Otherwise, you determine your required hours. Finding instructors, that's always tough, and it's getting harder. Once you've looked at your student certification outcomes and your curriculum, that will usually tell you what specific qualifications or Other areas, not necessarily so much, so you may have to. This is a tough area. It's not a state certification, but an industry could theoretically teach it. Look at what are the specific requirements and see that potential instructors have some expertise in those areas in order. If you can't find anything else in terms of levels of certification or licensing, adult designated or CTE, the other criteria, you could use those as a basic criteria for determining training instructors. Again, if you've had experience with the Boston Reed program and you've have a point of contact with those personnel that were teaching the Boston, that would be an excellent place to start if you're looking at medical field. We actually get most of our instruction from medical facilities where we're doing clinical staff and talking with the staff of the staff at these clinical, talk to them about whether they would be interested. Talk to them about if they would. Many of the proprietary for-profit, their instructors work on a part-time basis. Know that Boston Reed cuts. So those are all. One of the things that I've run into, and this has been most recently, County Office of Education, is what are they going to require in order for you to have how are you going to be able to pay them? Or are you going to have to see that they haven't already looked? The current CT adult ed designated subjects not what they were 2 years ago. district and how you're going to do that if you're going to haven't looked at them. Credential program get that preliminary credential, so there's well if you're trying to recruit in resources. Resources, we're talking about what things do you need outside of curriculum and in that's in terms of equipment program. If it's a welding program, clinical practice that's required. So again, those certifications and tell you what you need in terms of resources for this will go in to determine your cost of your budget. What was something we all really love, calculating our program costs. I'm going to go through a basic, simple CTE program budget to look at what is necessary as components. What are you going to need charge for tuition for this? This is a very simple CTE program budget spreadsheet, and this spreadsheet actually in a welcome to use it if there's nothing. Start with looking at the instructional costs. You have your curriculum and you determine what times the instructional hours. If you're going to pay the instructor for put any benefits in for the instructor, come up with your actual look at, are there any curriculum costs in terms of development? You would put out your initial cost for startup. Books and materials are usually charged if you're running a tuition program. The books and materials, you look at what it costs. Same thing with exams or certification. For those, then you these are the general supplies for the support of there's actually a couple of different ways you can do this. Try and track the supplies such as general don't figure it into the administrative overhead. You can also, when we get down here to breaking supplies along with the materials and fees, up with a subtotal of basically the program costs, and then you look at determining what is your administrative overhead. Something that not all of us look at very often. What are the other areas that are cost budget that are not necessarily instructional costs? This would be salaries, classified staff salaries, um, covered by the district, phone, copiers, leasing. That would all fall under administrative overhead. That is where you have to take that into account. But to keep your program viable, and since we're not allowed to operate programs at a, you can do that for your own agency. You can do a budget, taking out instruction. As I said, administrators look at those other facilities and whatever is charged out as a percentage of your overall school budget will give you a rough estimate. Most schools typically that I've seen have run between about 20 and 30% over what the cost of the entire program was. But that works out to the 25% of 2000 cost in. It actually off when I was creating the lets you know what you need to have in terms. But when we come to determining the one is going to have to determine what are like we used to do under ADA. Take our instructional cost plus the administrative overhead. We don't is up to you. You divide that by what you think should be the minimum number of students for the program and see how case the but just to start to figure as a basis of then I add in the books, materials, and dollars. So now that the basic proposed to Then you have to determine, is that reasonable? Is that reasonable? Look at, are there other programs of this type in the area or some low? Then if you say, well, reduce the number of students as a minimum. Cost for the all things that you have to look at for your area. So again, that's real kind of a quick and dirty time. I'll open up one last chat pod here, and if you have any specific questions or concerns related to budgeting that I didn't cover at a close here.
And Dave, as we are drawing to a close and folks are typing in their questions for the budgeting process, I know there were several that were in the chat pod on the left, but I am going to thank everyone in advance since we are getting close to our 3 o'clock hour. We will have this webinar recorded if you need to go back and look at it again and see if there are other pieces of information that come from this discussion that will help you in your goal of maintaining and building your short-term CTE programs. Dave, I want to thank you as well. And we have about 2 minutes. We will keep the room open until about 3:05 to allow some continual dialogue and engagement. For those of you who are able to continue, please feel free to stay on the line for the next 5 to 7 minutes or so. And Dave, I'll turn over to you to answer to the questions that are posted there.
Okay. Yeah, as Cherise said, the PowerPoint and the recording will be available. Costs apply to the school you're figuring out reusing them. Typically, yes. Your curriculum costs generally are one time. That's why you don't necessarily apply it to, but it generally gets covered in the administration certification. We've tried both. We generally found that charging them the certification, scheduling the certification exam for them at the completion of the best way to ensure that they took the certification and got what they needed in order to have done both, in which case we tell them one caution on that in the area. Did run a program on that and offered the certification testing at our site. I had to vouchers for the certification test. Costed, yes, it is hard to recruit. lots of required items not included in your budget. Those typically, well, if you're looking at that particular area in a short term, I think if you look at CNA, it does not require about 10 years before we developed an LV. Look at that as to whether there's a cost, but there are programs like that. And again, that falls under administrative overhead. Programs such as that, there can be a higher administrative. Don't like to charge for state exams. We want them. That's a decision that the program makes. Could provide them the information on are provided by outside agencies and cost. We've just had better results scheduling those and doing them as a funds to pay for them by charging them as.
All right. So, Dave, I'm going to interrupt now and again say thank you. We're going to have to bring this chat to a close, and so that brings us to our closing chat pod, which is where you will find the information that you've been asking for in terms of the copy of this PowerPoint presentation, the contact information for the third-party vendors that Dave shared with you earlier, and our survey for CalPro, which helps us to get feedback on future ideas that we can share with you. As you fill that out, we would appreciate hearing from you. And again, there are several documents available that you can upload, save to your computer, and then have those for future reference as well. Thank you again, Dave, and thank you to the participants for participating. We will be having another Administrators Forum webinar around the topic of AB 86 and regional planning that is currently scheduled for April the 16th. And if you check our calendar, you can register for that now as well, and we look forward to seeing you then. Again, we will leave the room open for several more minutes for you to download any of the materials that you see there that you'd like to keep for future reference. Thank you, Dave, again for sharing this information with us today. Bye-bye.
Okay, my clock says it's 5 after. If you're still downloading the documents that are made available, would you please type something in the chat pod to the bottom left if you would like more time to download the documents. Okay, I'll keep the room open for a bit longer. If you do finish before this meeting closes, the chat pod to the bottom right has a link to our evaluation form. We would greatly appreciate you fill it out. Also, when this meeting is closed, you should be redirected to that same form, but either way, you can get to it. And thank you for reminding me, Catherine. Yes, the recording of this webinar will be made available on our website, which will also have the ability to get these documents from there as well. Bye, Cherise. Bye, Carmen and Susie. Thanks for coming. Bye, Terry. Bye, Debbie. All right, so with that, I'm going to go ahead and close the meeting. You guys have a great day.